Hello, welcome to the audience of this video abstract. I am Giovanni Cammarota, a gastroenterologist, and today I am talking about the International Consensus Conference on stool banking for fecal microbiota transplantation in the clinical practice. Most hospitals screen stool on a per-patient basis. Although frozen and fresh stool are equally efficacious for the treatment of recurrent Clostridioides difficile infection, stool banking offers advantages in terms of availability of FMT, timely and effective access to FMT, safety and costs. There are no guidelines for building an FMT stool bank. Stool banking allows for FMT to be delivered on demand in a timely manner. Fecal samples can be thawed on demand and delivered to the lower gastrointestinal tract or the upper gastrointestinal tract. Stool bank also allows time for the application of rigorous screening protocols, enhancing the safety of FMT. Moreover, stool banking allows for multiple treatments to be collected from a single donor, thereby offering greater cost efficacy for fecal aliquot for FMT. The consensus process included several steps. First, the selection and invitation of 29 consensus members with documented expertise in the field of FMT and stool banking. Identification of main topics and the generations of working groups. Main topics were general principles, objective and general organization of the stool bank, a selection and screening of donors, collection, preparation and storage of feces, services and clients, registries, monitoring of outcomes and ethical issues. And finally, an update on FMT in clinical practice. Statements according to the best available evidence were then developed. For each key issue, the best available evidence was obtained through a systematic review of the pertinent literature. If the related statements were suitable for grade assessment, they were graded accordingly. Otherwise, statements were released only as expert opinion. The elaborated statements were uploaded to the online Delphi voting system and disseminated to the panel. Experts' responses were collected, addressed and shared again. Consensus was achieved if at least 80% of respondents expressed a strong agreement or an agreement with reservation. Statements that did not pass the threshold were revised and rated again in further voting rounds until consensus was reached. Finally, a face-to-face meeting was planned in Rome in order to release the final version of the statements. 3 rounds of voting were necessary to reach consensus for all statements. Respectively, 73% of statements passed the 18% agreement threshold after the first round, 90% after the second round and 100% after the third round. Overall, the expert panel released 40 statements. Of these, 17 were developed according to the grade approach and 23 were based on expert opinion. Among the main statements, it was recognized that stool banks aim to safely collect, store and distribute feces from screened healthy donors in order to treat CDI through FMT. Stool banks may also participate in research protocols under strict investigative conditions. Stool banks would relieve hospitals from the administrative burden of individual FMT donor programs and enhance the standardization of FMT. Recruitment of donors should be through a continuous structured workflow. The experts suggested a screening panel that should constitute a reference standard operating procedure of stool banks. The access to stool banks should be provided to physicians caring for patients with CDI. It cannot be provided directly to patients. Stool banks should store an aliquot of all delivered fecal suspensions to guarantee traceability in case of adverse events. FMT is highly recommended as a treatment option for multiple recurrent CDI. It is also recommended for severe CDI not responding to standard treatment and may be considered as a treatment option for fulminant CDI in patients unfit for surgery. Finally, FMT is a safe and effective treatment for CDI in children. Further studies are required before FMT can be recommended as a treatment option for other indications in clinical practice. In these cases, to date, the FMT should be limited to the research setting or compassionate use in the absence of alternative therapeutic options. This consensus report provides guidance on the general organization and the criteria required to develop a stool bank. The expert panel identified roles and positions necessary to start stool banking activities. A stool bank would guarantee the dissemination of FMT worldwide and the accessibility of this potentially life-saving procedure in an equitable fashion.